this kind of method has a certifying body, which it could be trained in, which is the American Association for Suicidology. Our team was trained. And actually, as a test case, because it was public information, they asked us to try to develop a psychological autopsy profile of a well-known suicide, specifically that of Kurt Cobain. I showed a picture of Kurt with not as a rock star, but as a dad, because I felt that this loss was also the loss of a father. Um, in his family, there had been suicide attempt or completion in four distinct relatives a generation before him. That's a pretty big risk flag by itself. His early life was characterized by parental separation and a lot of conflict between himself and the other parts of the family after the separation. He also had severe chronic abdominal pain, which to our knowledge has not been ever diagnosed. In the late 80s, he used heroin sometimes, and he referred to it as recreational use. And in his own writing, he said that he began to use it more regularly for care of his own pain condition, which was not diagnosed. And he described the pain as severe enough as making him want to kill himself. And this is when his career is really taking off. Amazingly enough, in 1992 to 93, he was briefly, for different periods from different doctors, on methadone and buprenorphine, two evidence-based treatments for opioid use disorder. And then in March, he actually had an overdose, not with opioids, but with alcohol and Rohypnol. There was an actual confrontational intervention by members of his family and friends. He was sent to a Los Angeles-based detox. He did not receive evidence-based therapy in 1994 for an opioid problem. He climbed over the back fence, went back to Seattle, and having had his guns taken away once, he managed to reprocure a gun and ammunition and died by a gunshot. And those themes all have potential clinical and policy lessons from a single case. Now, just imagine what would happen if you looked at 110 or 115 cases, as the VA has funded us to do.